Hey, LarkenRose here, trying to do a video the most awkward way possible with my laptop over there and holding a microphone. So, we'll see if I crash and die horribly. If so, get some interesting video of it. So, the health insurance CEO who got shot and killed recently, and there's, of course, everybody's having a big hubbub online about it. Now, as usual, the point here is not even to talk about that specific event. I don't even exactly know what the heck happened with that specific event. There are already things about the story that seem totally sketchy and suspicious and weird. But I want to talk about sort of the topic that comes up because the entire fiasco that is American health insurance is, as I've said before, essentially voluntary communism. And guess what? Communism doesn't stinking work, even if it's voluntary. Now, here's why I say that. If you had health insurance with a gigantic deductible, like, okay, if it's less than $10,000 or $20,000, I'll find a way to pay it myself. But if something catastrophic happens, then I'll, buy health insurance so that in the event that something humongous happens, then it'll pay for it. That could actually be useful and not a ridiculous disaster waiting to happen, because most people, hopefully, would never need anything paid out of it. If you're buying insurance for something that is almost certainly going to have to pay out for something, it's going to be really damn expensive. Then you're playing the game of to each according to his need. Whatever I need, this insurance company should pay for. And that is how people in America, probably lots of the world, view health insurance. They view it as if, well, I should be able to go to the doctor whenever I want, just on a frickin' whim, and get whatever treatment I want. And I'm not paying for it, so why the hell would I hold back on just going there constantly? And if I think there might be some reason to do something, I'm gonna go get it, because I'm not paying for it. Only, yes, you stinking are, because then you turn around and go, why are these health insurance premiums so high? Well, gee whiz, that's how communism works. From each according to his ability. Oh, suddenly we need you to do more, but I can't do more. Yes, you can, and we're going to make you do more. But. So, now, the people who complain about health insurance companies, there are, on occasion, totally reasons to do that, because health insurance companies are there to make a profit. So, in the overall gamble, it has to be, overall with everybody combined, it has to be a bad deal for the customer, a bad gamble, in order for the health insurance companies to make money. In other words, what you pay out in premiums, everybody cumulatively, has to be more than what the health insurance companies pay out for whatever medical stuff you're getting. Because if it isn't, they're not in business anymore. Not making any money. So it has to be a gamble that's actually a bad idea overall for everybody cumulatively. It's early, sorry. Now, for any one person, that might not be true, because it might be that you pay your insurance premiums and then a rabid moose bites your leg off, and that costs a whole lot. So for you paid in a whole lot less than they're going to pay out if it's something catastrophic like that. So for you might benefit. But overall for everybody can't benefit, or the health insurance companies wouldn't be in business. So it has to overall be a crappy gamble for the people cumulatively. When people expect insurance to cover normal things that everybody's going to have, or almost everybody, then automatically, hi Piggy, there's two piggies. waiting to see if they can give somebody a ticket. Go away, piggies. Then automatically it's going to overall be a crappy deal. So, when health insurance companies are fighting people and going, no, that's not covered, they have to try to minimize the payouts to stay in business. Now, do they sometimes minimize them in ways that are slimy and unfair and not really fulfilling their end of a bargain? Yeah, I've seen insurance companies do that. I've seen car insurance companies do that. I've seen health insurance companies do that. And whenever something is sort of debatable and, well, maybe we can cover that and maybe not, thanks for tapping me, buddy. Whenever it's sort of debatable, of course, the healthcare company health insurance company is trying not to pay out, and the people are trying to get paid out because they need, to each according to his need. I needed this. So what are the people always arguing? I needed this treatment. And the health insurance company is like, well, no, you didn't really need this treatment. Okay, now you're into communism, and the people in control are deciding you don't really need what you say you need. And the people who are expecting free stuff because they don't think there's a direct connection between what they're paying and what they're getting, because there isn't, they're whining about how they need more, and it doesn't work. It becomes a catastrophe. So the bitterness at health insurance companies is sometimes justified when health insurance companies are sort of doing slimy, unfair stuff and not really paying out when they actually should be. However, the entire catastrophic situation exists because people are trying voluntary communism, and voluntary communism doesn't work either. You are not entitled to whatever you need, and when people think they are, it goes badly. And even if there was actually a way, which there isn't, but even if there was actually a way for health insurance companies to very specifically describe, here is what we will cover, here is what we will not, like, good luck wording anything in a way that will describe every single case clearly. Even if they could do that, it would have to be a bad deal for reasons I already explained. Overall, for everybody cumulatively, health insurance would have to be a bad deal because the health insurance companies couldn't be in business if it wasn't overall a losing deal for the sum total of all their customers. So the only point in insurance that makes any sense, since sum total's going to lose, is each individual customer doesn't mind losing some on the bet that, well, if something really drastic happens and I suddenly need $1 gazillion, then the insurance company will pay up and help me out. And sometimes the insurance companies try to not do that either, because sometimes there's line balls. But the resentment of health insurance companies, like the resentment that's justified is when they actually do slimy, dishonest things that they're not really living up to their end of the bargain. If you're resentful about them arguing about what you really need and what you don't, you're kind of stupid. Of course they're going to do that, because there isn't a way to precisely define that. And they're not going to be in business if every time somebody says, well, I need this treatment, they go, here's the money, never mind, we're not ever going to look at it or question it or challenge anything ever. So, of course, they're in business to make money, so they're going to have claims adjusters or whatever the hell they're called to look at it and go, well, we're going to cover this, we're not going to cover that because we don't think that was really necessary. And the people are like, but I need. Yeah, your need doesn't entitle you to anything. Now, if the contract with the insurance company entitled you to something in a situation, okay. But if there's a gray area, of course they're going to argue against that. So, yeah, like I said, insurance companies do slimeball things on occasion. Pretty often, in fact. But just the resentment of, they don't give us what we need. makes about as much sense, even though it's voluntary, it makes about as much sense as people going rah, rah, rah for Mao and Stalin and then whining about the fact that, hey, they're only giving us like 3-week-old moldy bread. It's disgusting. We need more. Well, where do you think it's going to come from? Do you think the ruling class and or the health insurance company exists to be nice to you? Do you think it's a charity? Do you think this arrangement that they entered with you was for them to be altruistic towards you? If you think that of a ruling class, you're pretty damn dumb. And if you think that of a health insurance company, you're only a little bit less dumb. Still pretty damn dumb. They're in it to make money, and of course they have to challenge claims. Again, they do it in cases where it's slimy and dishonest too, so people can be pissed off. But the whole, oh, I'm glad they killed that CEO, why? Like, do you actually know that he was involved in anything? Well, he profits from them denying claims. Yeah, no shit. That's how that works. That's how insurance works. The insurance company makes more money if they don't just randomly hand out money to anybody who just asserts that they need it. Whether you're talking health insurance, car insurance, anything. Like, the one kind of insurance that actually all the way makes sense to me is life insurance. Because it's pretty clear whether they pay out or not. Are you dead? No, then they don't pay out. Are you dead? Yes, then they pay out. Now, every once in a blue moon, it's hard to tell if somebody died or not. Most of the time, it's pretty clear. Like, you're going to pay this. They are betting on the fact that you will live long enough that they will make money off of you before they have to pay out. A very simple arrangement, which is why most people don't hate life insurance companies, because there's no gray area. There's nothing they need to argue about. You're not really dead. I mean, every once in a while, somebody might fake their death, but for the most part, it's pretty clear cut. You're either dead or you're not, and that determines whether they pay out if you have an active policy with them. But just that so often people's resentment of things, like sometimes it's based on some things that are justified, but often it's just sort of this childish mentality of, oh, I don't like those companies. They don't give me what I want. Okay. Do they have an obligation to give you what you want? If there was a contractual agreement and they're actually obligated to do that, then yeah. Trouble is, if there's a gray area, of course they're going to argue in favor of paying out less often. And you're going to argue in favor of them paying out more often. Duh. To be upset or outraged by that is just idiotic. What did you think they were going to do? Now, again, when they do it to an extreme and dishonest degree, yeah, there's reason to be pissed at them and go, you slimy bastards. Like, I paid for this, I had this condition, doctor obviously said that was the case, obviously proved it, and they're still dragging their feet and trying not to pay out. They do that. And there's line balls for doing that. If there's actually a contractual agreement, like we paid insurance for exactly this situation, and now you're trying to not pay out because you're slime balls. That totally happens too. And that's worth resenting because that's breach of contract. But because there's a gray area, it's really easy for that to come up pretty damn often. And the only way to make that not come up constantly is for people to get out of the frickin' commie mindset that you're entitled to something because you need it. And that's how most Americans view health insurance. Well, I should just give them some amount of money, and it should be something I should be able to afford, from each according to his ability, just arbitrarily, never mind what they're paying out or whether it's worth it for them. I should just, for some reason, only have to pay out whatever happens to work for me. Like that should be the defining factor in what the price of something is what you can afford. Well, if I want a Lamborghini, it should only cost me what I can afford. Why the hell would you think that? That's bonkers and stupid and entitlement mentality, commie bullshit. And doing the same thing for health insurance isn't any less stupid. No, it shouldn't magically cost you something you can afford just because you wish it did. That's not how anything works. It's not how the price of anything works. But it is how the commie mentality of from each according to his ability works. But that's not reality. And then the flip side, of course, is to each according to his need. But now I need you to pay for this. Okay, was that in the agreement? If so, then they should. If not, then your need doesn't mean anything. And if you're outraged that they're arguing in the other direction, just duh. That's how this works. What did you really expect? Howdy, LarkenRose here, interrupting myself in my own video, because there's a thing I should have mentioned and I forgot while I was driving, so I'm throwing it in now, sort of where it fits, which is the issue of people whining about, the health insurance company wouldn't cover me because of my pre-existing condition. Why the hell would they? And this again shows the commie mentality and the notion that, but I need it, therefore they should pay me it. Insurance companies are about, you pay us some money, and if something happens, we pay for it. They can only be in business if they're getting more money from people than they're paying out. Duh. So if you walk into an insurance company and say, I'd like to get insurance for if my house catches fire, and they look out the window and say, isn't that your house on fire right now, right across the street? Would you say, that's not fair. How could you not cover me just because my house is already on fire? Because it would be fucking stupid for them to cover you. Why on earth do you think they have any rational, moral, or any other basis for contractually agreeing to paying a huge expense they know is going to happen in exchange for the relatively tiny little premiums you'll be paying? You're basically whining about the fact that this for-profit company doesn't want to give you a massive gift. And if they were dumb enough to do that, the only way they could do that is charge everybody else. So then everybody else's premiums go up, and then everybody whines about, we can't afford this, from each according to his ability. So one of the best examples of the commie mentality is the people who complain about, oh, they won't cover a pre-existing condition. Why the hell would they? Why would they enter into a contract where they know it's a certainty they're going to have to pay out a huge amount of money, and they know that your premiums aren't anywhere near going to cover that? Why the hell would they agree to that? That would be, business-wise, that would be stupid. And the only reason anybody would expect anybody to do such a thing is if they think their need, because of their condition, entitles them to have somebody else pay their medical bills, whether it's a health insurance company or government or whoever. So yeah, once again, you see the commie mentality shining through, along with massive economic ignorance, because you can't really have the commie mentality without massive economic ignorance. If you understand how reality works, then you understand how stupid it is to actually think that from each according to his ability to each according to his need would ever freaking work. Anyway, so yeah, some of the resentment of insurance companies is totally justified because they do slimeball fraudulent practices on occasion. Pretty often, I don't know exactly how often. And they should be resented for that because that's actually fraud. The thing is, there's a gigantic debatable gray area, and there always will be in something like healthcare. Well, did you really need that 27th physical therapy session after you fell off your skateboard? Or were the first 19 sessions enough? Let's argue about that till the end of time. This doesn't happen if people just pay for it. Now, the last thing I'm going to throw in is when people go, oh, but medical care, it's so expensive. You know why it's so friggin' expensive? Well, other than government making there be a monopoly and most people can't compete. The reason it's so expensive is because people have the commie mentality and they think health insurance is paying for it. A lot of doctors, and I've worked for doctors, a lot of doctors don't even know what their own procedures cost because the patients don't pay it. The patients don't know. The doctors don't even know half the time. Because they just submit it to insurance and then people argue back and forth of how much they're going to pay for it. And then people wonder, oh, why did the prices get so high? Because the thing that keeps prices down is companies trying to sell things to customers. And if they try to sell you a cheeseburger for $724, nobody will buy a cheeseburger unless everybody gets cheeseburger insurance and pays some premium. And the company's like, well, we can charge whatever the hell we can get away with. And now we're just arguing with the cheeseburger insurance companies. So when people are shocked about the cost of healthcare, they don't recognize that that's because you played the commie game. It's because almost everybody in the country plays the commie game of, well, I'll just pay to this health insurance company and whine about how they're making me pay too much, and then expect them to just pay out for whatever it is. Golly gee, look at the prices skyrocketing because the mechanism for keeping prices down is gone. And then it's through the roof. And it's pathetic that people literally blame capitalism for what is a direct result of the commie mentality. This is because it's profit-driven. No, it isn't, you idiot. If it was free market profit-driven and you have to, pay for what you get, like you go to the doctor, you go to the dentist, whatever, they say, here is the price for that procedure. Do you want to get that procedure or not? Here's what you will have to pay to get that procedure. No commie pooling of resources and shit. Just, you want it, you pay for it. That will keep prices down to where they, quote unquote, should be in an actually free market, which we do not at all have. But the ultimate irony is that people blame the profit motive and capitalism for what is directly a result of commie mentality, which is the friggin' health insurance system in the U.S. Now, like I said, if everybody had a $20,000 deductible or something, that would solve a whole lot because people wouldn't be running out to get every procedure they can think of because they'd have to pay for the first 20 grand and nobody's going to want to do that. And then it would just be catastrophic insurance, and that actually works pretty well. And that wouldn't make the prices go through the roof either. So, yeah, even a bunch of pro-freedom people, their resentment is often very vague and misguided. There are reasons to hate the health insurance companies when they do fraudulent stuff and they don't follow through on what they agreed to. But to expect them to be there for your benefit and just to be nice to you and give you gifts is as dumb as expecting government to be there for that. Hey, why did our taxes go up? Maybe it was because you kept asking for government to give you free this, free that, and free the other thing. It's almost like they have to get the money somewhere in order to give you free stuff. So anyway, I guess that's enough of a rant about that. As I drive across glorious Arizona, it's actually freezing at the moment. But yeah, just thought I'd rant about that and get annoyed. So I did. So there. Yeehaw. Carry on.